Long COVID is still a disease in great evolution progress, but I think there's a couple solid things we know about it, which has changed since long COVID began. I think number one is we all in the medical community know this is a real disease, and it's a real, the symptoms may not be well defined, but it's clearly a real disease with real pathophysiology we're trying to figure out and real triggers. So that's probably first and foremost. Number two, we've learned that certain types of people tend to predominate towards long COVID. The first people who had the original variant or the Delta variant in 2021 were much more likely to get long COVID than the current Omicron variants we're seeing now, which is part of it. There's sort of two big baskets. One is kind of what we would call constitutional or neurologic symptoms. The fancy term for that means big things that are more general, such as fatigue, brain fog, lethargy, sleep disturbances, a lot of just, being tired and not having the energy and needing a nap. Another big bucket is what we call heart and lung or cardiopulmonary issues. So chest pain, shortness of breath, trouble breathing, high heart rates, and sometimes the two overlap. There is a third group which sometimes has joint pain and rashes and other symptoms such as hair loss, which are very similar to the bigger fatigue ones, but sort of fit across both as well. We're still seeing that many of these people, years later, can't attend school and work and have meaningful, ability to function the way they did prior to COVID. And it's really hard for a lot of our patients. They want to go back to living life, they want to be better, and they just still can't. It appears as research comes out, there are a few things we can do to lessen the likelihood of getting long COVID. And if it does end up that we get long COVID, our symptoms may be less severe. And that's number one, to get vaccinated. And then number two, if you do get COVID, to get treated, usually with drugs like Paxlovid and some of the others. Now, the data is kind of new with that, but it appears that reducing, the likelihood of severe outcomes in COVID also will reduce the likelihood of getting long COVID. I would say the best thing to do if you do have long COVID is get involved in a medical community. So that would mean, for me, a couple different areas. One is see a doctor who specializes in long COVID. Number two, make sure they plug you into the areas of need that you have. So for example, if you have loss of smell and taste, if you have brain fog, if you have chest pain, you see the right specialists, ENT, neurology, cardiology or pulmonary. So you see the specialists you can get. That's one thing. Number two is there is a community, and a lot of this is psychosocial. So, any illness can feel really lonely and that you're very alone. So being around people who are in the similar shape, learning how to manage those symptoms, whether it's online and in person, has just been really, really helpful. I think I'm hopeful about treatment for long COVID because we are the first thing is recognition, right? So if you recognize that it's a disease, then the investments and the medical community, the research community all follow behind. So we're seeing a lot of that happening now in the last few years. So that's where this information is coming out. So I think it's very positive that we're going to have more information over time. And as people improve and we see the rates of long COVID decline, it'll sort of be a nice match where we can learn how to prevent it, how to sort of treat it. People will tell their stories about how they've gotten better over time. So I'm not generally an optimist, but I feel pretty optimistic.